Hello everyone, I'm Dr. Shreyashi Chatterjee and you're watching my channel, The Medical Diary of Dr. Chatterjee. And today in this video, I'm going to talk about 10 natural ways to control high blood pressure without any medications. So let's get started. High blood pressure or hypertension is a common condition that can lead to serious health complications like heart disease or stroke. While medications is often prescribed to control high blood pressure, there are many effective lifestyle changes that can significantly lower high blood pressure naturally. These changes may even reduce the need for blood pressure medications in the long run. In this guide, we are going to explore 10 lifestyle changes that can help control our high blood pressure and improve our overall health. Number 1 is lose extra weight and also watch your waistline. One of the most effective ways to control our high blood pressure is to lose our extra weight. Blood pressure tends to increase as our body weight increases. And also being overweight can lead to certain conditions like sleep apnea, which can further raise our blood pressure. For every 1 kg or 2.2 pounds of weight lost, blood pressure can fall by 1 millimeter of mercury. And this small reduction can make a significant difference over time. Now let's talk about the health risks which are associated with our waistline. Carrying extra fat around the waist and especially visceral fat can significantly increase our chances of high blood pressure. Men with waist measurements greater than 40 inches or 102 centimeters and women with waist measurements above 35 inches or 89 centimeters are at greater risk of developing hypertension, though these numbers can vary based on the ethnic background. Here are some tips for weight loss. Focus on eating a low-calorie but balanced diet, which is rich in whole grains, fruits and vegetables. And combine this healthy eating with regular physical activity to enhance our weight loss efforts and manage blood pressure effectively. Number 2 is exercise regularly. Regular exercise is another key factor in lowering high blood pressure. Engaging in physical activity can strengthen our heart, allowing it to pump blood more effectively and reducing the force on your arteries. Regular aerobic exercise can lower our systolic blood pressure by 5 to 8 millimeters of mercury, making a significant impact on our overall health. Types of exercise that you can try. Aerobic activities like walking, jogging, swimming, cycling, and even dancing are great options to improve our cardiovascular or heart health. Next is high intensity interval training. This involves alternating short bursts of intense exercise, periods of lighter activity, which can improve our heart function and reduce blood pressure more effectively than moderate intensity exercise alone. Next comes the strength training exercise. Include strength training exercises at least 2 days per week. This can help maintain our overall health and lower our blood pressure effectively. Aim for at least 30 minutes of moderate intensity exercise for most of the days in a week. If you are new to exercising, start with shorter sessions and gradually increase the intensity of the exercise as well as the duration of the exercise over time. Number 3 is eat a healthy diet. A heart-healthy diet is very effective in controlling high blood pressure. Eating the right food can help to lower your blood pressure by 11 millimeters of mercury. The DASH diet and the Mediterranean diet are excellent examples of healthy eating plan to control your high blood pressure. The key components of a healthy diet includes Fruits and vegetables. These are rich in essential nutrients like potassium, magnesium and fiber, all of which helps to regulate our blood pressure. Whole grains and foods like brown rice, oats and whole wheat bread provide fiber and help us to maintain a healthy weight, which is very much necessary for high blood pressure management. Next comes the low-fat dairy. Low-fat or fat-free dairy products provide us with calcium, which supports our heart health and regulates our blood pressure. Now let's talk about the healthy fats. Use healthy fats like olive oil, nuts and seeds for healthy fat sources that can promote our cardiovascular health. In addition to these, increase the amount of potassium in your diet. 3,500 to 5,000 milligrams of potassium per day can help to decrease your high blood pressure. Increasing your intake of potassium from sources like bananas, spinach and potatoes can help balance the effect of sodium, further reducing our blood pressure. Number 4 is reduce the intake of salt or sodium in your diet. Excess intake of sodium is a major contributor to high blood pressure, as sodium causes the body to retain water, increasing the volume of blood and putting extra pressure on your arteries. Reducing the intake of sodium in your diet can reduce our blood pressure by 5 to 6 millimeters of mercury. Now let's talk about the recommended intake of sodium. 1,500 milligrams of sodium is the ideal limit for most of the adults. Though reducing sodium to 2,300 milligrams per day, that is 1 teaspoon of salt, can still have a positive effect on our blood pressure. Tips for reducing our sodium intake. Check food labels. Many processed foods contain hidden sodium, so it is important to choose the low sodium versions whenever possible. Next is try to cook food at home. Preparing your meals at home allows you to control the amount of salt in your food. Try to use herbs like garlic, oregano or lemon to enhance the flavor of food without adding salt. Next is avoid processed food. Foods like canned soups, frozen dinners and processed meats like bacon and deli meats are often high in sodium. Always opt for fresh whole food instead of these processed food. By reducing the amount of salt intake in your diet, you can significantly reduce your high blood pressure and improve your heart health over time. Next is limit your alcohol consumption. While moderate alcohol consumption can have some health benefits, excessive alcohol consumption not only causes our blood pressure to spike, but can also reduce the effectiveness of the blood pressure medications. Guidelines for alcohol consumption. Women should limit alcohol intake to 1 drink per day, and men should limit alcohol intake to 2 drinks per day. 1 drink is equal to 12 ounces of beer, 5 ounces of wine or 1.5 ounces of spirit. Now let's talk about the effects of alcohol on our blood pressure. Limiting our alcohol intake can lower our systolic blood pressure by 4 millimeters of mercury. However, drinking alcohol more than the recommended amounts can significantly increase our blood pressure and the risk of other health problems. The next point to control our high blood pressure is to quit smoking. Smoking does not directly cause our blood pressure to increase, but smoking significantly increases the risk of heart diseases, stroke and other cardiovascular problems in people with hypertension. Every time you smoke, your blood pressure temporarily increases, and over time this can lead to chronic hypertension. Benefits of quitting smoking. Immediate impact is within 20 minutes of quitting smoking, your heart rate and blood pressure begins to decrease. The long-term health of quitting smoking is after 1 year of not smoking, your risk of heart disease is cut to half, which is especially important in people suffering from high blood pressure. But if you are struggling to quit smoking. Always seek support from your healthcare professional. You can consider nicotine replacement therapy, or even you can join a support group. The next point is get a good night's sleep. Sleep is crucial for our overall health, and insufficient sleep can contribute to high blood pressure. Conditions like chronic obstructive sleep apnea and insomnia can disrupt a good night's sleep and lead to high blood pressure. What is the recommended amount of sleep? Adults should aim for at least 7 to 9 hours of sleep per night. Sleep allows our body to regulate the stress hormones and maintain a healthy blood pressure. Here are some tips for better sleep. You should always stick to a sleep routine. You should go to bed and wake up at the same time every day to regulate your body's internal clock. Always create a restful environment for sleep. Ensure that your bedroom is cool, quiet and dark. Consider using earplugs, blackout curtains or a white noise machine to block the sound disturbances. Avoid stimulants before sleep. Limit the amount of caffeine or coffee or alcohol just before bedtime. Both alcohol and caffeine can interfere with your sleep. If you suspect that you have a sleep disorder like sleep apnea or insomnia, always consult with your doctor. The next point is you have to manage your stress. Chronic stress can lead to high blood pressure by triggering spikes in blood pressure during periods of anxiety and tension. Over time, this can damage our blood vessels and lead to persistent hypertension. So how we can manage our stress? Identify the triggers of stress. First, try to determine the sources of stress in your life, whether it is related to your work, your relationships, or your finances, and then develop strategies to manage them. Practice relaxation techniques like deep breathing, meditation, and yoga. Or even Tai Chi can help to manage your stress effectively. Spend more time outdoors. Engage in your favorite hobbies. Take short breaks throughout the day. Focus on what you can control and let go of the stressors that are outside your control or outside your influence. By managing stress, you can reduce the impact of stress on your blood pressure and improve your overall health. The next point is you should track your blood pressure at home and also get regular checkups. Monitoring your blood pressure at home is a great way to track your progress and ensure that lifestyle changes are working for you. Home blood pressure monitors are readily available and can provide you with the real-time feedback. Benefits of home monitoring. The benefits of home monitoring are you can get the immediate feedback. Regular monitoring allows you to see how different activities like food, like exercise and other lifestyle changes are affecting your blood pressure. Regular blood pressure monitoring can also give you motivation. Seeing positive results from lifestyle changes can motivate you to continue with your efforts. In addition to home monitoring, regular checkups with your healthcare provider are also important in managing your high blood pressure. Your doctor can assess your progress, adjust treatment plans, and ensure that your high blood pressure is under control. The next and the last point is you have to control your blood cholesterol and your blood sugar levels. High levels of bad cholesterol or non-HDL cholesterol and high levels of blood sugar are often linked to increased risk of heart disease and high blood pressure. So managing our blood cholesterol and our blood sugar is very much crucial in maintaining our cardiovascular or heart health. High levels of LDL cholesterol can build up in our arteries, leading to atherosclerosis, which narrows the arteries and increases our blood pressure. So keeping cholesterol in check can improve our blood pressure and also reduce the risk of heart complications. On the other hand, high blood sugar can damage our blood vessels and also the nerves that control our heart, contributing to high blood pressure over time. So people with diabetes are more prone to develop high blood pressure over time. To manage your cholesterol and blood sugar, always follow a heart-healthy diet. Exercise regularly. Of course, avoid smoking and take medications as advised by your doctor. So we can come to the conclusion that controlling blood pressure without medications is possible, but through a series of effective lifestyle changes. By losing weight, by exercising regularly, by eating a healthy diet, reducing our salt intake and managing stress can significantly lower our blood pressure and reduce the risk of heart disease. These changes not only improve our blood pressure but also support our overall health, potentially reducing the need for blood pressure medications. Stay committed to these habits and consult your healthcare provider to ensure that your blood pressure remains within a healthy range. Stay healthy, stay fit. Thank you.